morning, Dr. Patino here at the Cosmetic Surgery. We're going to do high definition. We're going to show her muscles and everything is incredible. And this is microwave power assisted liposuction. Basically, it's like an electric toothbrush, right? So you go ahead and turn it on and the tip vibrates, so you don't have to be jamming the instrument back and forth. The fact that you have this instrument doesn't mean you're going to use it properly. The fact that you have an electric toothbrush does not mean that you're going to use it properly. If you use it like an old toothbrush and you keep going back and forth at full force, guess what? You're going to have gum bleeding. Well, the same thing is true here, okay? So notice how my strokes are so calculated, so slow, so meticulous. And guess what? When you do that, there is not going to be gum bleeding when you brush your teeth. So what do you see there?
I see yellow fat.
Exactly, because we're using this instrument properly. So that's number one, okay? Number two, in order to obtain this beautiful fat aspirate without a speck of blood, it is imperative that you instruct the patient not to take any aspirin-like medications, no ibuprofen, no herbs, no vitamins of any kind for 2 weeks before and 2 weeks after the procedure. It is imperative that the surgeon does not give any aspirin-like medications, no ibuprofen, no herbs, no vitamins, no enoxaparin, no heparin, no blood thinners of any kind. It is common for surgeons to do so, to give all these medications and blood thinners, and of course you're not going to obtain this aspirate. It's going to be impossible. Look how beautiful this, show them this is like what, without a speck of blood, right?
Wow.
And it is just unbelievable, and it is not just one case. This is predictable. We can tell our patients, you know what, if you think we're picking the best videos, that's not the case, okay? We show you whatever the patient gives us permission to do, we show it to you, and we can tell them, you know what, forget about the videos, that the multiple hundreds, if not thousands of videos of bloodless surgery that we have, right? Just look at tomorrow's case, right? Well, today's Friday, so it's not going to be tomorrow, Saturday, we're off, but Saturday is the Sabbath, right? The Sunday is the Lord's Day, right? We honor the Sabbath on Sunday according to the Catholic Church. I'm Catholic, so I don't work on the weekends, right? I dedicate that to the Lord, right? Sunday to the Lord. But on Monday, you can watch whatever surgery we have on Monday. They give us permission, so you can see the bottom line here is that we're showing you actual cases that we do on a daily basis, and we can predict that this patient is not going to have any bleeding. And the beauty of that is that we are going to obtain a fat that is completely pure. The fat graft is going to be oil-less, meaning without oil, because we're not traumatizing the fat cell, so it doesn't leak oil. And it's going to be bloodless, because we do not traumatize the tissues. And because of these multiple measures, because of the type of anesthesia that we use, the amount of anesthesia that we use, and I'm talking about the anesthesia that we put in here, right? The time that we wait before we start. If you do this and you do all these things and you put very little, and you put it in and you start in 5-10 minutes, there is going to be bleeding. You're not going to be able to obtain this aspirate. So it's multiple things, right? The most important thing is the operative technique. And if you're in a rush and you're doing multiple cases in one day, you're not going to be able to do this either. So obviously, if you want to be taken care of, if you would like to have a procedure in a meticulous manner like this, if you don't want to bleed, if you want to have much less risk of anemia, much less risk of bleeding, and a much faster recovery in days instead of weeks or months, give us a call. We'd love to see you. But we do this predictably all the time, consistently all the time. Thank you. Hello, beautiful fat, huh?
Oh, yes.
This is incredible. Do you see any bleeding in there?
No, I don't.
So this is the fat graft that's going to go into her buttocks, right? And this fat does not need to be treated in any way. So sometimes what happens is that the surgeon aspirates this bloody output with oil and blood, and they have to wash it or process it. There is commercially available systems that wash and process the fat after it's collected. We don't need that. Why? Because we obtain it oil-less and bloodless to begin with. So it doesn't need any processing. And yes, we go slower, but at the end of the day, our times are extremely efficient. Why? Because we don't have to process that fat graft. That fat graft is going to go into our buttocks the way you see it. So later on, we'll show you that this very same bloodless and oilless aspirate is going to go into our buttocks. Thank you. Awesome. So we are doing an ultrasound guided gluteal fat transfer. Remember what I told you. Show them, Sylvia, show them that fat graft that's going in is completely oil-less and bloodless, right? This is how we got it. This has not been processed in any way whatsoever, other than we collected it in 500 ml of normal saline, but it hasn't been processed. So what I'm doing, I'm looking at the patient, I'm looking at what's going in, a completely oil-less and bloodless fat graft, and I'm looking at the ultrasound, of course, to make sure that we go into the deep subcutaneous space so that we keep it according to the guidelines of the World Association of Gluteal Surgeons, and we keep this procedure safe. I usually give 100 one bottle. 100. Thank you, and then we move to the next side. Thank you.